I'd like to introduce you to the Johnson family. This is Sally. She's 13 years old. Hi, Sally. She's not always this shy. See, here she is with some friends at a Justin Bieber concert. That man beside her, the one wishing he was anywhere except a Justin Bieber concert, is her dad, Bill. Hi, Bill. Bill's a construction manager for a national house builder and a part-time taxi driver, ATM machine, and chaperone. Here's his wife, Maria. Hi, Maria. She works 3 days a week for a local real estate agent. The housing market isn't great either, but Maria is very good at her job. See? Living nearby are Bill's parents, Henry and Charlotte, or Grandma and Grandpa, or Mr. and Mrs. Johnson to you and me. So what's so special about this family? Nothing much. That's the point. They are just a hard-working American family, bobbing about on the ups and downs of our struggling economy, just like you and me and everyone else. But hard work isn't enough to guarantee financial security these days. Things are getting worse, and not just for the Johnsons. As earners, we're worse off than we were a decade ago. Here's Sally when she was 3 years old, back in 1999. The annual median average household income in the U.S. then was around $53,000. It's been downhill ever since. Adjusting for inflation, that figure 10 years later was almost $3,000 lower. There have been uphill struggles for American households in that time, too. This is Sally's older cousin, Daniel. In 1999, when Daniel was 12, the average annual premium for family health care coverage was a little under $6,000. By 2010, that figure had more than doubled to $13,770. That was his heavy metal phase. We're all very glad it's over. But statistics aren't much use when it comes to the individual circumstances of families on the receiving end of bad luck and the vagaries of a struggling economy. The Johnsons are, as I said, no different. They've had their share of bad luck too. For example, you'd never know it to look at her, but last year Sally was diagnosed with juvenile or type 1 diabetes. It strikes out of the blue. More than 1 million Americans have it and will never outgrow it. It's one of the most costly chronic diseases, as sufferers have to administer daily doses of insulin. As long as Sally and other kids with chronic diseases are covered under their parents' policies, they're probably okay. But earlier this year, like tens of thousands of other construction workers, Bob lost his job, and with it, his family's coverage. Maria has become the main breadwinner, but like an increasing number of small businesses in America today, her firm can't afford to provide health insurance to its employees. Finding coverage for Sally was now extremely difficult, and not just because of the expense. Big insurance companies don't leap at the chance to sell coverage for people with pre-existing conditions. Henry and Charlotte would have liked to help, but they've got their own problems. They are both on Medicare, and they both have to take expensive medications. The Medicare drug benefit helps to a point, but because of something known as the donut hole in the drug program, they have to pay $4,500 each before their coverage kicks in again. They don't have that kind of money, so they've been splitting their pills and have quit taking some of them altogether. What about Daniel? Well, he's a bright kid, just graduated from college, but jobs are thin on the ground and competition is fierce. So Daniel has been living with his parents to save money while he tries to start his career. But he turned 23 recently and was automatically kicked off his parents' health care policy. Daniel, young and in good health, is what the insurance companies call a young invincible. But with no job, no money, and no health coverage, he doesn't feel that way. So what happens next?